is Sunny Ruggeri from the University of Massachusetts.
Hi everyone, my name is Sunny Ruggeri. I'm assistant professor in nursing in UMass Lowell. So I'm going to talk about applying data mining approach to oral endocrine therapy. There are like 4 sets of very popular oral endocrine therapy medications, and looking at that patients' adherence behaviors among women with breast cancer. So let's talk about just the background about my topic. So as everyone knows, the breast cancer is the most prevalent type of cancer, especially in women in the United States. And it's the second highest cause of all cancer death, and it's about like 300,000 patients, new cases reported, especially in 2019, and about 40,000 deaths recorded in 2019. So here I want to highlight about the medication non-compliances. In research term, we actually utilize adherence is actually a little different term that captures more about how patients are not taking medication correctly. Specifically, it's about $20 billion projected about not taking medication correctly for the breast cancer patient in 2020. So why they are not taking this medication correctly? Because these oral endocrine therapy medications, they need to take it at least 5 to 10 years. And now we are strongly recommend patients to take this medication for at least 10 years after they did a mastectomy or any other therapy in conjunction with. And this is an oral, so it's medication that you're taking by mouth, means that they take it at home and no one actually watches it. So healthcare team actually would not know how much they are adherent about this medication. And the other thing is about 80% of breast cancer patients are taking all this medication at least 5 to 10 years. And again, it's now new regimen is 10 years. And mostly they are taking tamoxifen. There are tamoxifen aromatase inhibitor, we call the AIs. So tamoxifen is a pre-menopause women are taking that, and post-menopause women takes AIs. And unfortunately, a lot of research actually done by refill records, means that when patient picking up the medication from pharmacy, we put that as the refill records that they are taking medications. So we are focusing on older women with breast cancer, since breast cancer is also more about that older woman gets it. So unfortunately, cancer is also older people's disease this day. So I utilize the SEER Medicare data sets to understand these data sets. So let's look at how this works. So this is a breast cancer cell, the pink area, and there's a estrogen receptor. The tamoxifen is the medication that blocks the receptor, so the estrogen cannot bind it to the receptor, so that cancer cell will not grow. So that is why we are telling the patients to taking tamoxifen for 5 to 10 years, so they will have a lower risk having a breast cancer. And the other AI medication will be anastrozole, exemestane, and letrozole are the most popular other medications for the post-menopause woman. And I utilize 2 theoretical framework. The first one is socio-ecological model that it's well-known theory that patients in the center and microsystem, mesosystem, exo, macro, so we can really understand what caused this patient not taking medication correctly. And the other model is a 5-dimensional of adherence, which is actually built by World Health Organization in 2003. It's actually pretty similar when you're looking at it. It has a patient-related factor, condition-related factor, socioeconomic factor, therapy-related factor, and healthcare team related factors, and I can correlate it between to the socio-ecological model. So we just categorize it so that we can help the patient better when we identify which risk factor really pops out from there. And first, I start using the SEER Medicare database. This is a HIPAA-compliant multi-facility United States data warehouse. It has more than 9 million cancer cases, and it, excuse me, it has over 470,000 new cases every year they added. And this is actually the biggest cancer database in the world, and it does capture about like 70 to 80% of the entire cancer population in the United States, so we can really look at the real data. And this is how the database actually looked like. So the SEER is the cancer registry, and the Medicare actually, they work together. So the SEER cancer database have some demographic data from the SEER registry, and they will have the cancer stage data and radiotherapy and chemotherapy data in there too. And then they have prescription drug information, which it has a PDESAF. So we will see that if they're taking the oral endocrine therapy, those medications will be in the database. And then the Medicare data sets linked, so we will see the MBSF data sets. So the Medicare data has the chronic condition information, so that we can link it back that if they have any mental illnesses or dementia, any chronic illnesses that Medicare highlights, so we can also link it back to see any a depression diagnosis, they have it as well. This is also very interesting because this is how Medicare actually calculate their insurance costs depending on their condition, and it's actually really helpful for the research to see how things are related. So one of the methods I'm using actually is a decision tree. It's because decision tree is just the most simple one from the machine learning tools, and it's actually really beneficial when you have a lot of missing data, since a lot of Medicare data set, especially when patient married or not, some people will not share that information, and that's okay. It's not mandatory thing to share. And we still need to see, those marital status did affect our medication adherence or not. And from just looking at the other way, looking at regular statistical method, you will have a lot of constraints because of missingness, but the decision tree will just looking at the data that we have. So it actually gives a better idea how things are connected in that way, and then it's one of the easiest way to look at it. So again, it's a very clear logic. So we can tell the healthcare workers, especially because I'm in nursing, I wanted to highlight nurses that who's not taking medication correctly from looking at the decision tree. So I start obtaining sample from the SEER Medicare data set in 2019. That's the most recent data that I could get. It was 140,000 breast cancer women who's older than 65 in the United States. And actually, if you remember my introduction, about 200,000 patients are newly diagnosed every year. So I would say that's like a real number that how much it's available out there in the United States. So this is one of the very interesting study, I would say. So we started from the multivariate logistic regression to see, utilizing those theoretical framework, what really pops out looking at each factors. And as you see, that a star means that higher significant data. So like obesity and having stage 2 breast cancer, and ethnic group, African American group also highlighted, and using alcohol, using tobacco, and being single or divorced, or patients switch the medication in between OET means that patient was taking a aromatase inhibitor, but now when they change to different types of AI, or they taking now tamoxifen, some people are keep switching medication. It could be many different reasons, like a side effects. Whoever switched their medication, they are the factor showing that they are not taking medication correctly. And depression, and also when institutions share the position, like when patients go to see the clinic, there are several oncologists there, and it's not always the one oncologist. That's actually the factor patients are not taking medication correctly as well. So putting back to the decision tree, I chose that 4 very strong factors from the logistic regression from big data analysis. So depression, using tobacco, obesity, and switching medication as each factor. And when you put it into the machine learning system, they will actually calculate it, what's the highest possibility falls into each decision tree. And this is the diagram. It's about 92% accurate that this is how it flows. So it means that when patients switch medication, they are the highest factor that showing that this is one of the highest risk factors. So I can actually give it to the nurse to tell when patient ever had a history changing medication, they are one of the highest risk, and that's one of the highest factor as we see the calculation from 140,000 population. And then let's say, okay, the patient switched medication from tamoxifen to the letrozole, yes. And then is the patient smoking cigarette is the next one, tobacco, yes. And then we will put them as the highest risk population to watch it really carefully, because there will be, we are predicting those population will not taking medication correctly. And on the other side is a false that if they did not switch medication, also the obesity does come out as other factors, so that higher BMI 30, then now the nurse can really watch it carefully. Okay. So decision tree mirrors like human decision making. So it's a really intuitive, and also it's very easy for the healthcare provider, and even all the healthcare team can really understand this easily to show that how this falls down, so that we can prioritize which patient we need to watch it over. So one of the study actually currently I'm doing is I'm doing the pilot RCT, doing clinical trial with a nursing intervention, and we are using this machine learning tool, and then whoever pops out as the higher risk, we do a more intense the nursing intervention and see if patient actually will take medication better or they will not. So we can evaluate if this tool was effective. The limitation of this study is, again, this is using the SEER Medicare data set, so that's been there 2019, and it could be a little different than current situation, because we go through the COVID, and we are looking at the old data to looking at it, so it's a little different than other prediction study of drug discovery that we cannot really predict in the future in that way. We are looking at from SEER Medicare from begin with. So our team is thinking about using neural network to looking at in the other way as well, so that we can test it out in the other way clinical trial. And this can be also addressed by other way, like a random forest to improve reliability. And this is one of the first trial of our study that shows that decision tree really identify those key determinants and how it's related to each other, so that we can really help the patients whoever suffer from medication non-adherence, and understanding this all multi-level influences to the patient, it's really important to know so that we can help the patient to take medication better. Well, thank you so much. Yes.
Very nice. There's two things you might consider, because we do modeling off SEER and a number of things. SEER has an ICD-10 or 9 code for breast neoplasm, and you may find different response for different subtypes of breast cancer rather than just breast cancer in general, because obviously some are much more significant. People may be sensitized to that. And the other thing is, you were looking at tobacco. Tobacco, again, we've done studies for something else where we've looked at tobacco, alcohol, and other drug use as examples of addictive behaviors, so that the question is really, are people more or less compliant and adherent if they are used to they have addictive behavior characteristics or non-addictive behavior rather than the tobacco by itself.
Well, yeah. Thank you so much for the comments. It's actually very interesting to know more about it. So yeah, actually, just because of those, like a stage of cancer that we got rid of the stage 4 of the breast cancer from the diagnosis. I forgot to mention that. Sorry about that. But the tobacco use was actually really helpful to know. Thank you so much.
Any other question? Oh, yes, there. Over there.
Hi, thank you for a very nice presentation. I'm wondering if there are any other databases that you think you might be able to link into to expand the, to make it a more of a multi-parametric decision. Because there are many different resources available that would supply potentially different data on the same individual characteristics.
Thank you so much for asking that question. That's actually a really great question. Medicare data sets actually not really ideal for the individual characteristics. That is correct. I did suffer to find more factors from that individual characteristic. I was just thinking about working with the VA team, since my university just worked with the VA, but still the problem is a lot of individual factors are not really mandatory data sets from the patients, so patient would not really share that. So that's why I think that machine learning tool was actually really attractive. When we not know much about the data, we can predict it. One of our preliminary research actually shows that the breast cancer populations are more vulnerable from depression and being separated. They need more love and care than other cancer patients. It was like really popping out compared to other cancer like a prostate. So it means that we actually saw when patient divorced or when patient is widowed, or they're single, they suffer more taking medication correctly. So we wanted to investigate further how to do those. But so far, I was not that lucky to looking for more registry. So if you can share a little bit more, I would love to hear and learn from you. Thank you so much for letting me know.
Yes, I have a couple of questions related with your way. I mean, when you took the decision of using decision tree, yeah. So did you like, because it's a predictive model, but you compare with what? So do you say, if I change the drug, what are you going to see? The variables, depression, blah blah blah. Mm-hmm. So how did you make the model? How did you? So you compare with what when you are using decision tree? Because then you say, now I'm going then to change with another algorithm in machine learning. So
Right. So, I mean, I just started from the logistic regression to see what's the really like a popular factor when you look at the odds ratio. When you see it, even switching medication is actually 172% higher than who are not changing medication. So means that it's about twice more people are not taking medication correctly when they are switching medication. So like you can kind of look at it from the logistic regression too.
yeah,
And then what we do is we grab several factors from here that really highlighted one, and then we can run the decision tree and see the most accurate way how it falls into each way, like the next one. So that so the machine learning tool will calculate it, each factors, and like it's more likely what comes first, and then that's the really strong factor that we can really assure. So our logistic regression was also correct. So it kind of confirms it, and it's actually more strong because logistic regression does not really have the missingness, understanding that.
what about if you use super vector machine?
Super vector machine?
Yeah.
Yeah, I did thought about like a SVM. But we just started from here. Obviously, yeah, this is like just most the starting point, but that's actually a really good way to kind of go
and
forward.
the recall,
Yeah.
because when you know, as a suggestion,
Yeah.
just because you are, when you present a model, it's good that you show us at least the measures, recall, for example, because in that way we know exactly from the prediction, like for example, if 0.7, we
Right.
know that from 800, at least your prediction of 70 people are correct.
Right.
Otherwise we don't know exactly, if we can trust, not we trust you, of course, but, kind of trustable the model. And then
Right.
in that way we can suggest you probably to go super vector machine, because you will increase your N number. You need to have more patients, probably add more variables. So in that, that you say, for example, depression is a very strong point. If you add thinking about different variables associated with depression, like for example, with the mood disorders, you amplify the variables that you will be entering in depression classification. Yeah, like I don't know, asking about how is it in work, if they are changing, if with the family they are changing every day. I don't know if they feel with more energy, less energy. All this kind of indirectly measure if they are in this kind of changing mood because you are changing the drug.
Right.
So, try to increase the way to see. So in this you have more variables, and if possible, I will, because I'm working on all that, so I will just use super vector machine, because super vector machine work in proximity. So it's comparing two variables, how closer they are one from the other. So in that, you have more and more data you can get it from and results. I don't know.
That's a great idea.
It's a suggestion.
Yeah, well, thank you. Yeah, that's one way to really look at the inner layer. Thank you.
Yeah, to address your question about the databases and looking at other databases, and I think what you found, part of the challenge, and it's true of any machine learning approach, you're doing data-driven modeling based off the data that you have access to. And every database that you are using was built effectively from some model, which is why they collected the data that's in that database. And so now you have the limitation that the AI ML can't go beyond that model. And that's the challenge you have when you're using an AI ML approach. As I'll point out, we've go from a model to the data, not from the data to a model. And so what we've actually done is, because we've gone through all the international databases, and we don't have the data we want. So we've initiated our own studies to collect the missing data, because that's the only way you're going to be able to expand the models beyond what the database was created off of.
But yes, he has a question or comments. Yes, well, that's a very good point. Actually, I love to hear that, because actually that's why I'm doing another pilot clinical trial to see that and see what to collect it. That's actually the thing that I'm very interested in. I'm still not sure which one I should really collect it though. Well, you're ahead of me, so I would like to learn from you too. Yes.
I'd just like to follow up on that. There's a phrase going around now called data intentionality. And what they mean by that is, when you're setting up basis, which is what we just heard, is that you look for what's going to be done with it, what you anticipate the goal is, and you try to make the collection and the organization and labeling universal enough that all the potential purposes are served. So they call it data intentionality.
Thank you so much. Yes, I will write it down and work on that too. Thank you.
Well, now, yes.
And just to reveal conflict of non-conflict.